priest, a politician, and a public health nurse walk into a bar. The priest says to the bartender, "I believe in faith. Give me a beer." The politician says, "I believe in voters. Give me a whiskey." The nurse says, "I believe in evidence-based practice." Religion and government each have a role in public health. So give the priest his beer, the politician her whiskey, but give me their car keys. I'm the designated driver. So what does it mean to be a community health nurse? We strive to keep folks out of needing inpatient care. While public health focuses on known diseases and conditions such as HIV/AIDS, smoking, TB, community nursing goes beyond public health in that we try to find people where they are, such as the patient room is outside of the hospital door. We dig into the social determinants of health, aware that the further down the ladder we go, the messier it gets. Sadly, the population at the lowest rung of this ladder is growing rapidly, those who are experiencing homelessness. According to the Challenge Seattle January 2024 report titled "Emergency at the Epicenter," there are now about 900,000 visits to Washington State emergency departments made every year at a cost of $1.15 billion. This report also states that in Washington, 1 out of 275 residents is unhoused. Yet the rate of unhoused in emergency rooms is 1 out of 10. In other words, the homeless population in our state is 0.34%. The homeless in our emergency rooms is 10%. Isn't it about time that we put nurses in the middle of this extremely vulnerable population? In November of 2024, another nurse and I started a free clinic in Tacoma's largest emergency 24/7 shelter. It is also the site of the highest demand of 911 services. 2 months later, we received a letter of appreciation from the Tacoma Fire Department for having reduced the number of calls at this address. So now let's talk about Jack. A week ago today, last Thursday, 911 was called in response to a grand mal. He awoke from the seizure and refused transport to the hospital. 6 hours later, he seized again. This time he agreed to transport to the emergency room. He was discharged from the hospital 8 hours later on a higher dosage of an anti-seizure drug. Catherine and I monitored him daily, when on Tuesday, 2 days ago, he reports that his drug from the ER ran out and his insurance will not pay for the refill. The pharmacy filled the drug but needed $20. After an hour on the phone to the pharmacy and to 2 insurance companies, there was still no assurance that the drug would be covered. Since it costs taxpayers $3,525 to dispatch a 911 unit, and the bill of an ER visit is well over $1,000, and the fact that he will probably seize again within the next 48 hours, a $20 bill will save about $5,000 in EMS services. As nurses, we can do the math. And as nurses, we are advocating for this high needs, high barrier to care population. We have met so many folks who have fallen into houselessness due to health condition. The only treatment that will help them is universal health care and affordable housing. Community nursing is more than caring for a targeted population, though. It is an exercise in empathy that starts in nursing school. We are all here because we had nurse educators who fostered a desire to promote health by transforming nursing research into positive outcomes. That's an academic way of saying how our teachers cared about us and about our future patients. I'm deeply honored to have 3 of my former and current instructors from UW-Tacoma School of Nursing here tonight to share this honor with WSNA. They taught us Gene Watson's theory of caring. It's a theory based on research that suggests that building relationships between patient and caregiver leads to better health outcomes. Because Jack and I had such a relationship, it was easy for me to treat his gap in care with a $20 bill. We'll work on the system problem later, together. Nursing is grounded in caring. It is a gift that benefits the giver as well as the receiver. Community is what we build together. Community nursing for me is a joyful opportunity that defines a life well lived. Thank you for this recognition and for caring.